In modern American cities, tents line sidewalks beneath skyscrapers. Under highway overpasses, entire communities exist in the shadows of prosperity. Homelessness feels like a permanent feature of the landscape now, but it wasn't always this way. To understand how America reached this point, we have to go back to a moment when the country believed it was doing the humane thing, closing its mental hospitals. In the early 20th century, hundreds of thousands of Americans with mental illness lived in large state-run psychiatric institutions. These places were often overcrowded, underfunded, and abusive. By the 1950s, investigative reports exposed neglect, forced confinement, and inhumane conditions. Public outrage grew. Reformers argued that institutionalization stripped people of dignity and freedom. The solution they proposed was deinstitutionalization, moving patients out of hospitals and into community-based care. The idea gained momentum in the 1960s. In 1963, President John F. Kennedy signed the Community Mental Health Act, promising a nationwide network of local mental health centers that would treat people close to home. The vision was compassionate and modern. Patients would receive therapy, medication, housing assistance, and social support. Large institutions would become relics of a cruel past, but the promise was never fully kept. Between the 1950s and the 1980s, the number of Americans living in state psychiatric hospitals collapsed from roughly 550,000 to under 100,000. Beds disappeared faster than community services were built. Funding was inconsistent, and many mental health centers existed only on paper. When patients were discharged, many were handed little more than a prescription and a bus ticket. At the same time, another crisis was unfolding. America's housing market was changing. In the post-war decades, affordable housing had been plentiful. Single-room occupancy hotels, boarding houses, and low-cost apartments provided shelter for the poor, the elderly, and the mentally ill. But urban renewal projects in the 1960s and 1970s demolished entire neighborhoods. Cheap housing was replaced by offices, highways, and luxury developments. Rent-controlled units vanished. The safety net shrank. By the late 1970s, homelessness was no longer rare, but it was still largely invisible. Then came the 1980s. Federal housing support was slashed. Spending on low-income housing dropped dramatically. At the same time, funding for mental health services declined, particularly at the federal level. Responsibilities shifted to states and cities, many of which lacked the resources or political will to respond. The number of people with untreated mental illness living on the streets began to rise. The visible homeless population exploded. By the mid-1980s, major cities reported tens of thousands of people sleeping in shelters, subway stations, parks, and doorways. New York City alone saw its homeless shelter population increase more than fivefold in a single decade. What shocked Americans most was not just the numbers, but who the homeless were. Veterans, families with children, women, and people with severe mental illness were now living in public view. Public perception hardened. Instead of seeing homelessness as a policy failure, many viewed it as a personal choice or moral flaw. Laws criminalizing sleeping, loitering, or panhandling spread across cities. Police became the frontline response to what was fundamentally a housing and healthcare crisis. Meanwhile, wages stagnated. Manufacturing jobs disappeared. Union power declined. For millions of Americans, a single medical bill, job loss, or rent increase was enough to push them into homelessness. Studies showed that a large percentage of homeless individuals were employed but could not afford housing. The idea that homelessness was caused only by addiction or laziness simply did not match reality. Mental illness remained a central factor. Estimates suggest that around 1/4 of homeless adults in the U.S. live with serious mental health conditions. Without stable housing, treatment becomes nearly impossible. Without treatment, stability remains out of reach. The system traps people in a cycle with no exit. By the 2000s, homelessness had become entrenched. Emergency shelters multiplied, but permanent solutions lagged. Temporary beds replaced long-term housing. Cities managed homelessness rather than ending it. Tent encampments became semi-permanent, tolerated in some areas and violently cleared in others. Each sweep destroyed what little stability people had built. The COVID-19 pandemic exposed the crisis in stark terms. Job losses, rising rents, and fragile healthcare systems pushed even more Americans to the edge. Eviction moratoriums temporarily slowed disaster, but when they ended, homelessness surged again. By the early 2020s, the U.S. recorded the highest homeless population since national tracking began, with over 500,000 people experiencing homelessness on any given night. What makes this crisis particularly haunting is that it was not inevitable. Other countries faced similar challenges: mental health reform, housing shortages, economic shifts, yet did not produce homelessness on this scale. Research consistently shows that housing first approaches, which prioritize stable housing before treatment, are effective and often cheaper than emergency responses. America's homelessness crisis is not the result of one bad decision, but decades of policy choices that valued cost-cutting over care, profit over people, and punishment over prevention. Closing mental hospitals without building support systems created vulnerability. Destroying affordable housing removed safety nets. Treating homelessness as a nuisance instead of a systemic failure allowed it to grow unchecked. Today, tents are not symbols of individual failure. They are monuments to broken promises. Homelessness is history happening in real time. It is the visible outcome of decisions made long ago, decisions that continue to shape lives every day. Understanding how America arrived here is the first step toward imagining something different, because homelessness is not just about the absence of shelter. It is about the absence of responsibility, compassion, and long-term vision in a nation wealthy enough to do better but still struggling to choose to.